Welcome to the Path to Be Well podcast, a podcast about being well. I'm Doug Rawson. Join me, Mark Tremblay and Paul Clory each week as we answer your questions with the sole purpose of helping people who suffer from a chronic medical condition in considering the safe use of cannabis so you can have a better quality of life. In this podcast episode, Mark and Paul discuss the importance of knowing what your medications are for and is an essential part of your health selfie. This understanding can help you develop your treatment goals and your health plan while aiming to get the optimal results you desire. We hope this episode will help clarify your medication history while assisting the development of your treatment plan. If you have a topic that you would like covered in a future podcast episode, please leave a comment at weedwell.com. Now, let's join in on the conversation.
Welcome to our broadcast, The Path to Be Well, a knowledge and learning session. To all our listeners, we're so happy that you have joined us. And please note that you can also subscribe on our YouTube channel or find us at weedwell.live. These sessions are focused on adding clarity regarding cannabis as a treatment option and whether or not it's right for you, and will bring clarity to help you make informed decisions with respect to improving your quality of life. Now, you may know someone that could benefit from this type of information. So please do us and them a favor by sharing this event. Hi, my name is Mark Tremblay, a founding member of Simcoe Holistic Health and Weedwell. I want to share with you how I became involved with cannabis as a medicine. As a teenager, I did sample marijuana and quickly concluded it just wasn't for me. I will admit I did find myself judging those who did consume marijuana, thinking that their sole motive was to get high. It wasn't until many years later that I discovered the true medical benefits of marijuana. A loved one was diagnosed with MS. After many months of symptom manifestation resulting in sleepless nights, I witnessed firsthand just how cannabis can help alleviate symptoms and improve sleep. My eyes were open and my interest further increased. As a result, Simcoe Holistic Health opened its doors in 2013. And since then, we have served nearly 6,000 patients ranging from ages 3 to 93. I have personally witnessed countless individuals and families experience improved quality of life. Having said that, I've also observed that cannabis treatment is simply not for everyone. And for that reason, I want to caution our listeners that cannabis treatment is not a one-size-fits-all. Determining if cannabis is an appropriate treatment requires the attention, care, and focus of your healthcare team. At Weedwell, we are committed to helping people improve their quality of life, and utilizing cannabis as a treatment option is one way to accomplish that. So joining me again today is my colleague, Paul Clory. So Paul, welcome.
Thanks, Mark. Good day to you.
Yeah, likewise, Paul. So Paul, the topic today is get clear about medications. So what does that mean?
So we are back in the be clear stage of our path to be well. And, to reiterate, be clear is our first stage. And as the name suggests, clarity. We want to get a handle on things that are happening to us in the here and now and our past. So one of the things that we want to get a handle on is our medications. And this helps contribute to our health selfie. This has come up in other conversations, but it's going to be a piece. So along with your symptoms and how you feel and stuff like that, the other piece is your medications, and it's going to help provide some clarity and some touch to that health selfie that you're creating. And so one thing where this starts with in a clinical setting, Mark, is prescription lists. And every single patient that will come through our door we request a prescription list from. Do you want to talk a little bit about that?
Yeah, absolutely. It's such a critical and very significant thing for a number of reasons that I'm sure we'll be talking about. But by providing that list, the doctor, by looking at the list, itself can typically get a pretty good idea as to where the patient might currently be and what the patient might be treated for, in addition to all of the other assessment forms that the patient would have completed prior to seeing the doctor for the first time. The prescription list in itself for a doctor that's been around for a while would tell him pretty good story as to what that is. And then the other benefits, of course, is looking at maybe identifying, and we encourage patients, and part of the program is to encourage the patient to go back to the prescribing doctor to get a better understanding, if they don't already have, what the medication is and what is it really treating. So it's all part of that selfie, that health selfie, and understanding, where the patient is at. So getting a good, clear understanding of what medication, the dosing, and what is really the intention of that medication.
Excellent, Mark. Well put. And so it's great when you have access to that doctor. Another source is your pharmacist that can help you provide this information. The other place is, if you're a regular prescription filler, you're on a constant medication, let's say for blood pressure or cholesterol, so you're filling this monthly. Every time you get that prescription in the little baggie, they usually staple something to it. All about the medication, number one, but the medication receipt, usually on the flip side, will give you your past 10 or 15 or however many, based on what pharmacy you go to, how many prescriptions you've filled. And so there's your list right there. However, if you don't have access to these for whatever reason, that's okay. Weedwell.tips, we have a sample medication record to help you get clear. And in it are some of the things you've touched on. I'll reiterate, Mark, a little bit. You want to name the medication. You want to know how often you're taking it, once a day, twice a day, and when. And also the dose. You talked about doctors being around. I'll put on my paramedic hat world for a moment. And the other thing is the dose tells you a lot of things as well, because you get used to certain medications that are quite common. I always go back to blood pressure medications because there's a lot of people that are on them. And so if you see a dose like 10 milligrams, it might signify this is an introductory dose. So someone who might be on the cusp of, but if you start seeing 30 and 40 milligrams twice a day, that type of thing of that same medication, that might say this person has really high blood pressure or it's not quite controlled yet. And the person doesn't even have to open their mouth to tell you this. You kind of get a feel for it. And so that's why we want the dose as well. Having the diagnosis, this is another column in the Weedwell.tips chart. Having the diagnosis, it's important to know why you're taking a medication. And so when we know why we're taking it, we kind of have an idea of the goal in mind of what we hope to achieve with that medication. We want to know who it's prescribed by. The patients that we meet quite often have a lot of things going on, insofar as, the chronic pain might lead to anxiety or depression, and then you begin to get a really large list. Well, with those types of conditions, often people will see specialists. When their family doctor or family nurse practitioner can't get a handle on it, of course, they refer. And so keeping track on who's doing what is quite important as well. And then you want to know the date that the medication's prescribed. And keeping a record of this is important because some medications we take as needed, or you would see the letters PRN sometimes right on the bottle, as needed. Others say take once a day, 4 times a day, whatever the case may be. One of the evaluation tools when we go down the road to be well, that PRN medication, as an example, you might find a success is the same amount of pills that were in that bottle when I started this journey are the same amount at the end of the journey. That's a win. Much the same as if you find that you're not getting a lot of success in something like that, you might see that you've had to refill that medication. That's kind of a synopsis of our sample weedwell.tips, medication record. But so we talked about kind of the how and what goes into it. Mark, if I could ask you, why should we do it though?
Well, it's really such an important role, as I said initially, and it's not unusual for patients that come to see us. The second thing that comes out of their mouth often is, "I'd like to reduce the medication that I'm on." So the patient needs to understand that. The physician prescribing the cannabis needs to understand that. We need to understand that. So it's very, very important to have those details so that we could really have a wholesome conversation and come up with a treatment plan that would, ideally line up with what, the goals are of the patient. And then in addition to that, and we've talked about this before, but always important to include that in our discussion when it comes to medication, is potential interactions with the medication that is so significant and important, actually can be critical to have a good understanding of that and take cautionary measures if or when required.
Yeah, that's an excellent point. There's a few things that we could continue on there. But we'll go off on a tangent just to your last point, the medication interactions. We did talk about this a couple weeks ago. We touched on it a little bit in terms of CBD. And the reason we did with CBD and say not THC, most of the interactions are with CBD. So it becomes interesting because CBD is viewed as, we'll say, the benign part of cannabis. And mostly because it's not euphoric or not going to cause the intoxication as THC. But once introduced to the body, it can cause some problems. So, we were just having another discussion earlier today, and this exact thing came up. So a couple of things you can keep in mind for our listeners and viewers out there. If you have a warning of grapefruit, and you tend to see that, especially on a cholesterol pill, is a common one. You want to inquire. This would be with the prescribing physician or the pharmacist about CBD interacting on that pathway. So the grapefruit pathway, if you will. But the other ones, the big ones that are potential for issues, we've talked about tamoxifen before in that same CBD discussion. We want to talk about blood thinners like Warfarin, and some of the blood pressure medications as well. The Warfarin, it can lead to bleeding issues or potential bleeding issues if not done in the right quantities, and CBD will affect that. So we want our pharmacist, our prescribing physician on board. And with the blood pressure medications, you might find that it's, we'll call it, for lack of a better term, overactive. And so it maybe lowers your blood pressure a little too much. And so you begin to experience things like dizziness or lightheadedness, or like you want to faint. It's great if you stay on your feet, but if it has the potential where you actually drop, then we have the associated injuries with that. So it's a little bit of a tangent there, Mark. I think it was an excellent point, though, that you brought up with regards to why we do it and the interactions. Those are a couple of examples of, we'll say serious or potentially serious interactions that we don't want happening. All that being said, as you mentioned as well, the individuals looking to substitute medications is a common client that comes through our doors at the clinic. And rightly so, you talked about having the right expectations and what you can and can't do. But I think it would be important to talk about something we call limit changes around starting treatment with cannabis. Can you share something about that?
Yes, absolutely, Paul. And that was part of our discussion, even this morning in a different setting, of course, not being live. But yeah, it's many come to us with a somewhat ambitious goal and wanting to, make a change in their lives. And they're willing to take significant, in some cases, drastic measures to try to get there. And we use this often enough in that this is not a quick fix pill, and this is not a one size fits all, and it's not a miracle thing. It's a tool in the toolbox to help a patient, accomplish their goals of improving their health and their wellness. So we caution patients to not make drastic changes in what their current treatment plan consists of: medication, perhaps chiropractic care, or other healthcare therapies that they're currently under, not to make those changes just yet. Really take time to reflect, to assess, but to start low and go slow with cannabis. And under the care and guidance of medical professionals, as you introduce cannabis, at some point, we can visit with the patient when might be an appropriate time to look at those other treatment modalities that they're currently on. And I say we, meaning, the healthcare team, the family physician, our physician, and in any way that our team can help them as well.
Excellent. I don't know if I could add anything more to that. It's very well put, Mark. The one thing I'll circle back for a second that I neglected to mention on our WeedWell.tips medication record. We're not just talking about pharmaceutical prescribed medications. And I did not mention this, but I want to make sure we get this across. Supplements, even vitamins, and then over-the-counter medications, be it the Tylenols, Advils, Tums of the world. We want all that there. All have the potential to interact. And again, most are benign or have no effect, but you get a full medication list there. That's the end goal. And that's, painting your full picture of your selfie. That, is the high level, if you will, on getting clear about your medications. Is there anything else you wanted to add or go to, Mark? Or
actually, Paul, I think we've covered, at least the important aspects of that. There's really nothing else that comes to my mind at this point, Paul.
Okay. So then, if we summed up the getting the medications together and, what you're actually trying to get out of it. We've talked in previous lessons about empowering individuals, empowering the person. And this is another empowering thing. And so if you can come away with why you're taking a medication, and believe it or not, there are a lot of individuals, and this isn't meant to point fingers or shame or anything. There's a lot of individuals that will take medication because the person on the other side of the desk or in the office said to take this medication. And I understand the hows and whys and some of the history of why that happened as the doctor-centric care. We've always promoted more of a bilateral care model where you take control, you take ownership, you can advocate for yourself. So understanding your medication and why you're taking it is one way you can advocate for yourself. The flip side to that, if we have side effects, and I talked initially about having that piece of paper or paper stapled to the top of your prescription, they list in there the side effects. And when you take a medication, some things might happen. And when you look in there, it's totally expected. And a lot of the side effects are, we'll say, uncomfortable or benign. So when you see something like may cause diarrhea, that's not going to hurt you long term, but it's definitely uncomfortable, less than desirable. But understanding that, okay, that happened. It is one of the side effects. That is acceptable. That's something that might happen with this medication. Whereas if you have something completely off the wall or different, you consider looking at that paper and you don't see that there, that becomes a red flag. I need to talk to the doc. Something different is happening to me. And so if we figure out, as being a good patient, an advocate for yourself, why am I taking the medication? As in, what do I hope is going to happen taking this? And if something else happens, is this normal or abnormal? And do I need to further look into that? Is kind of how I would summarize. If you get anything from be clear about your medications today, I think that might be it.
Paul, I couldn't agree with you more. And in simplistic terms, I would just like to emphasize the importance and significance of your medication, a very thorough medication list, and even supplements, as you mentioned as Paul, because they all play a role. And that links me to journaling. If we can kind of go off on another little tangent there, Paul, because it's all part of it. And if you will be changing any dosing under the care and supervision of your prescribing physician or your pharmacist, then that should be noted as well. So all of those changes in your treatment plan and your journey should be documented, because if anything happens down the path that you want to gain clarity on, you go back in your journaling and saying, on this day, I changed that. And so, Paul, any comments on that?
That's exactly it. It's a great point. When you go into a doctor's office and you give kind of one thing, the doc may or may not be able to come up with it, especially if it's something odd. But if you're journaling it with regularity, as you say, and then you start putting a story together, you kind of see how you start with a one-line plot line, but now you have the journal and you add 3 and 4 lines, you get a really good description. Well, now when you go to that doc or nurse practitioner or your healthcare provider, all of that extra body or evidence helps them get to where they need to be, and in saying, that's really bad and we need to order a test because that's really bad, or we need to change this medication, or I know you don't like it, but we have seen this happen before and I'm glad you wrote it down. We talk about advocating for yourself, but in a way you've made your doctor's job easier as well. And when they're on the same page as you, less is likely to go awry or sideways or where things aren't so good. So well done linking it to the health journal and why we should.
Yeah. Well, Paul, who's kidding who? All of the topics in the modules in the Path to Be Well are in fact linked, and they build on each other. So they all have their respective roles, but combined roles as well. As you were speaking, I was thinking of Cynthia and a comment that she had made. And we all know that as a medical professional, that she understands the value of journaling. But she did say that because of the medication that she was on, the lack of sleep, that she was really being challenged with brain fog. And so brain fog to me is one more reason why journaling is so important, because details can become vague and difficult to really hone in on what the issue is. So again, and I know you remember the story, thanks to her husband, who said, Cynthia, you need to be journaling because there's lots going on here. And, you talk about your brain fog. So even more reason to be journaling. Paul, I know we bounced from one topic to the other. I think they're all well connected. And I believe that there's value in really highlighting those things that we talked about today.
Absolutely, Mark. Things don't happen in what I like call silos or their own thing. They all become interrelated. And you brought up the be progressing part with the health journaling, and you're 100% right. They're linked together for a reason. And we've used the terms, stepping stones or bridge or little path. Well, it's a path to be well. There's a reason for that, and we want them interconnected. We understand that some people will gravitate towards some tools more than others, and that's fine. But if you find a way to implement all these tools, it really does increase your chances of success. There's no promises, but the other thing we find is people come in and they gravitate towards one thing. For us, or for my experience, I would say be informed, because they know they feel rotten. They feel rotten for a long time. They've had pain for a long time. So how is cannabis going to help me? And often we got to say, circle back for a minute, be clear about yourself, get that health selfie in. And of course, the medication piece that we've talked about today. And sometimes that proves very effective in figuring out where you want to be, just identifying where you were. But I do appreciate the client coming in and going right towards that because they want to get better. It's been a long time since they haven't been well. And so putting the brakes on and slowing down is sometimes a very effective thing to do.
Mm-hmm. And Paul, I've heard you say this before, and just to piggyback on what you just said, they've been feeling that way for a long time, but also it's taken a long time to get to where they are today. It's been a progressive, unless, something sudden happened, an accident, that sort of thing. But for the most part, it's been a progressive degradation in health, increase in pain levels and other symptoms that are associated. So to think that you can flip a switch, so to speak, and you're back to, call it the norm, is not realistic. And we know that, and we always make it a point to try to work with the patient to set reasonable expectations and then the SMART goals. But we're not going to go into that topic today. But Paul, any kind of closing comments, summarizing from your perspective on really getting clear about medication?
Okay. My summary is this. It's an important step. Mark, you've mentioned some of the reasons why. To get a handle on your medications, prescribed or over the counter, and your supplements as to why you're taking them. And that becomes, what do you hope to happen because you're taking this? The flip side to that is, if side effects happen with any of these things, it's easier to identify or relate it back to medication A or supplement A or whatever the case may be. All these things make you, we'll call you, a better patient or a better advocate for yourself and your health care when you go see your doctor, your nurse practitioner, your specialist, or whatever the case may be.
So very well said, Paul. And I'm going to wrap up by really highlighting our disclosure here. So Paul, great having you again today, and I look forward to next week's. So to all our listeners, I'd like to remind our audience that these information sessions are intended for individuals who are in generally good health, are generally well adjusted, are functioning effectively, and are not in need of medical treatment, including mental health disorders. These information sessions do not involve the diagnosis or treatment of any medical or mental disorders and does not prevent or cure or treat any mental disorders or medical disease. Further, these sessions are not a substitute for therapy, counseling, psychoanalysis, medical treatment, substance abuse treatment, or the advice or services of a medical professional. It is your responsibility to seek independent guidance from medical professionals to the extent necessary. So please do speak to your healthcare provider about the appropriateness of cannabis as a treatment option. And for those who have taken some steps in improving their quality of life, congratulations. Remember, your journey is your journey. And as long as you are taking steps forward in improving the quality of your life, you should be proud of the progress that you are making. At Weedwell, we are committed to helping people improve their quality of life And utilizing cannabis as a treatment option is one way to accomplish that. On behalf of our team, including those behind the scenes, until the next time, I say, be well.
Thanks for joining us this week on the Path to Be Well podcast, a podcast about being well. Make sure to visit our website at weedwell.com, where you can subscribe to our show so you never miss an episode. While you're at it, if you found value in this week's show, we'd appreciate you sharing this podcast or leaving a comment or rating. We look forward to you joining us next time. Until then, be well.